Thank you very much for the two presenters. Mine is somehow a comment and also a question. What are we doing as a nursing profession? The very wrong way of asking a question, but I have no alternative. I am seeing nursing as one of the most, under threat profession. The scope of nursing is shrinking by the day. The preventive aspect is being encroached by the public health officers. The other aspects, reproductive health and mental health, by the clinical officers and other people. MOAS is a grassroots level where now enrolled nurses' roles are being taken by the CHAS, the community health assistants. We're so much obsessed, sorry to use that, with higher level of studies, which is of paramount importance because we need, but at the same time losing the base. I'm seeing a lot of functions that the nurses used to do is being encroached. What are we doing to safeguard our position? And that's why many of us are actually graduates from MTCs and others, but we can't get a job. The issue of let's scrap enrolled nursing, let's do this. The enrolled nurses are actually the original people who have had nursing in their hearts. Those with BSN, believe me, they miss medicine and dentistry and they have to come up with that option. If we lose the people on the ground, we are actually getting nowhere. So how do we safeguard that? The last one is a comment, and Madam Registrar, I want to really echo you the point you raised, that nursing is the epitome of standards in the Republic of Kenya for all the professions. Our standards is top class. I have two of my colleagues from the Mewa College of Professional Studies here, and we had a training for CDAC. And all the words they were using, and I tell my people, they changed the vocabulary, but all the statements they use is what the Nursing Council uses in our practical way of assessing. We have very high standard of professional practice and training, but we need to appreciate how we can able to safeguard. Thank you so much.
Thank you, Edna and Pamela. My name is Edith Isheha. I'm a neonatal nurse working with Nurse 360. I have a question. One of the challenges that was listed is staff shortage, and this has been a real problem on the ground, and I think we are all aware of this. I'm just wondering, what are we doing as the regulatory body, first of all, to help us not have this shortage? And some things that we are doing, for example, staff rotations are working against us. What can we do to make sure that we don't have the staff rotation? I like that mentorship was mentioned by both Edna and Pamela. Do we have a structure to make sure that the new nurses who are not here are mentored? What plan do we have as the regulatory body? Yes, thank you.
Now, I have one comment, and then I'll ask a question. The reason why Ecsaconm exists is to be able to speak authoritatively on issues around nursing and midwifery within the region. And if you bring it home, to be able to be an advisory to the policy makers, the ministry, etc. Now, then my question comes, how much are we doing, and this is to Dr. Juma, from the training perspective? In your presentation, you have talked about Africa contributing probably 2% to the body of knowledge out there, yet what is available has its origin from Africa, from Kenya. And I know as you represent the education institutions, one of the things that I would like to know is whether as universities or middle-level education institutions, you are able to support research other than just research being a requirement for those who have to meet their graduation requirements. People have to do research because they have to graduate. Do we set apart? Because colleges and universities now are generating revenue. How much of owned generated revenue is set aside to support research? For example, now in nursing, where you are, do you have a budget that provides support for nurses to carry out research? Number two, to the registrar, nursing and midwifery now and the whole spectrum of health in Kenya is rapidly changing. And we have a lot of legislative pieces that we see flying. I am aware that regulating nursing training at the university level may no longer be the mandate of the council and many other councils, because Q has taken it up. And there is a bill currently in Parliament that has been moved. There's another bill that has come to amend university education. How are we positioned to be able to safeguard that the people who end up in our colleges, in our universities, really are people that are going to uphold the profession? Or is it now that we are being taken away this responsibility, globally nursing now has become so competitive that people are moving from other professions to come and do nursing, isn't it? Because they know if the minute you land in Montreal, you just get a job. So people are ready to do anything. They are ready even to sell land to go and do nursing. How are we positioned to ensure that we are able to protect this profession? Thank you.
Okay, thank you, Mr. Omia, Fred, for the question. There's one question on research that I'll address, but I'll also chip in as Edna will be responding on others. So for what we are doing to build capacity of nurses to do research, I think many universities are now growing. We have universities starting PhD in nursing. Nairobi University has PhD in nursing. I don't know how many others have. But we're also seeing more postgraduate programs coming up, master's programs that are intended to develop people's capacity in doing research. So with this, we hope we'll have more people coming in to do research, but that's not enough. Research to be done adequately for people, faculty to do research, we have to have strong policy. I'll give an example of a Presbyterian University that I joined a few months ago. They did not have a strong research culture. Working at the director of research, and some of the mechanisms we put in place is to build capacity for research. And this is beyond the usual master's and PhD programs, because we don't have a PhD program yet. But how can we support even nurses at master's level who are lecturing to do research? One of the things that we've achieved is convincing the council to allocate some funding, intramural funding for research. 2.5 million has been allocated for the period, and this will not be given freely. Nurses have to have capacity to do research, to write a proposal, a convincing proposal. So this will be a competition between nurses, educators, people in business, but you have to have a proposal, and to be able to do a proposal, we are also going to train them on grants writing. So you have to understand how to do grants. The manual will only provide some seed grant to enable you to start off so that you can be a PI in a bigger funding, external funding, which is there, but most of the time we don't get the funding because we don't have the capacity to write proposals, we don't have the right networks, because to get external funding nowadays, you also need to collaborate with other Western institutions. So how can you be able to engage with others who are, already published 100 papers and you're just publishing your master's papers? You have to have the skills. So we are going to train them. And I think the other thing, so training includes even on research methodologies, qualitative, quantitative, how to use softwares so that they can be able to write award-winning proposals and compete with the others. And I believe this is happening in other institutions. And the other thing, I talked a lot about advocacy. Advocacy. We need to advocate for more funding. Even the NRF funding that we mentioned, it's a very small percentage. How can we get this NRF funding to be able to do nursing research? As we do public health research, community health research, we are leaving even me, I do more of community health research. I wish I could be doing more clinical research. The main reason why I do public health or health systems research is because the funding is, most of the funding supports that, but we do not have a lot of funding to support clinical research, which we really need. I don't know whether that answers part of the question. Yeah.
All right, Dr. Malim, thanks so much. In regards of the issues of under-provision, under-threat, I've just shared with you community services bill, USF and OMIA. I've shared with all the board members, so Nyongesa, I'll expect you to liaise with your colleagues to give me the response. The same with Pauline, liaise with the NNA, and also DNS, liaise with the other DNSs, so you can give us the response. I did appear on Tuesday and extremely short notice to the Senate Health Committee, and I requested they give me until close of business today so that I can be able to get that. So if you see that bill, please just take 10 minutes, just give me what we need to do, because in that bill there's nowhere nurse is mentioned, but I did mention to them how that the nurses should be able to basically support that. And thanks also in regards of the standards and that. Edith, I really appreciate that. I just want to challenge you that before we come here, propose a mentorship framework, say that it can be adopted. So that part of the outcome of this conference is that we have a mentorship framework, because we don't have that and it can be adopted. I even see, let me just acknowledging, it can be adopted within the EXA region, a mentorship framework, and issues of challenges and that. I also want to request our directors for nursing who are present here, leading institutions, how best can we address issues of retention, because that is the employee's responsibility, issues of shortages and that. And also, what is Nasikasole of Kenya doing? I think we went and made noise in Meru County. Did you see advertisement of how many nurses? 300 nurses. Longisa County, they have seen the CNO. We spoke to Bomet County, how many? So we are having a lot of gains in regards of that. Frederick, in regards of legislative, I think I've been able to share issues of CUE. Just yesterday in the morning, before I got up my flight, I did a memorandum to Honorable Nyikal. Honorable Nyikal, in fact, should have been invited here. He is a real advocate for nursing, and he tasked me to coordinate with the other boards and council, including engineering board, legal council. We'll be having a meeting on 21st, but I shared what he will be able to present. They will give us an opportunity to go to the educational committee. I've already spoken to the chair of educational committee. I've also spoken to Mudomi, the CEO chair, and I hope how many of us will be attending the COG conference next week, because I can organize. Thanks so much. Please let us, just let us know who will attend, because I'll have a side meeting with Mudomi, the governor, who is in charge of all the governors in regards of health sector, so that we can tackle from the governor point of view, parliamentary health committee, and also the educational committee, which we have given our responses in the task force in regards of that. And so some of you who've asked us the relationship between us and CUE, we need to be able to tackle with that. Finally, just give me 3 minutes. I quickly peruse the ones I've answered. I have a lot, and I just promise I will answer, but my friend here doesn't want to give me much time. Okay, so issues of publications, if you know that you've asked issues of research and publication, I think Pamela, Omia, receive Pamela, sir, we can be able to work together. Mentorship model, I've already requested Edith to be able to streamline that. Issues of publication, again, it's supported by NNA. What we talked about retention of nurses, I say let us also talk to the governors and CC's health, how best and what strategies can we. So I'll also propose part of our outcome is issues of immigration and what strategies are better for retention. At the same time, again, let us also propose as nurses and midwives profession, how we can integrate those who have gone out of the country. I have so many, they want to come back. The other time when I was going to Canada, I found one and they told me, Edna, give me a job at NCK with 100,000, me, I'm coming back. So they are ready to come back. So let us also propose how, when they come back, we really need to receive them, so that we integrate them to be part of that. In regards of license, what is it? What? Yeah. So sorry, colleagues. It is, how do I just say it? It is ironical, but there's some of us, how many of us have undertaken their studies outside the country? How many have done their PhD? You can raise your hand higher. Okay. Could you have a chat with those of us they think it's ironical? Yes, let us have a chat. There are some of these, after we had that long discussion, how comes you did not retain yourself in UK? You will tell them. Yes. So, yes, he was given a job there. Issues of uploading the documents to the system, yes, we are undertaking that digitalization, and I say that we are a model, we have all those documents, we are finalizing, because it's a lot of things. We need to upgrade our softwares and ensure that also our documents cannot be copied and pasted, so we need to think through, so we are working on that. Issues of shortages, I want the DNSS to help us. Issues of standards, I say that regulation is collaboration. I cannot walk to my friend Taru's hospital and is a director of nursing and start, dictating. So I can only urge, and we have that conversation. So we are having the quad leadership, and thanks so much, Dr. Windsor, of course, Nyongesa, Collins, and representative for the education. We've had a lot of conversation on how, and we have thematic areas. I think the next thing we will be inviting the members for us to share with them our thoughts, and we request also for help, because we know that if you ask something about TVET institution, I just want to just say that, especially the outcome of this conference, if we can take even in the afternoon, we give comments on the memorandum of the bill and then we submit. That is the only way. That's the only way. Otherwise, we'll be talking to ourselves. So I've shared that document. I just want to request the leaders that I've shared with them, please collate and share.
There's a good question about ethical approvals, how nurses can be supported to get ethical approval for their research. I think we are trying in this area as a country. KEMRI offers ethical approval for all the studies done in the country. AMREF does it very well also. But we also encourage institutions to have their own board, because KEMRI is expensive. AMREF is also expensive too, especially for those who are in clinical setups and doing research in those areas. So how can we support this? We need to, even institutions, the hospitals, like KNH has an ethical approval board. I think Jaramogi Oginga Odinga has. I've sought approval from them for an evaluation, and we encourage other institutions to have their own boards. And there are also opportunities for training on how to, just general knowledge on how to manage an ethics committee. I think Kenyatta University is offering such, Kenyatta National Hospital, there's another call going around for people to apply to be trained. Those are opportunities that we can grab as nurses, but also advocate at our institutional levels to establish such committees. There's a question on supporting nurses not only to do research as part of the academic requirement. I think any nurse can do research at any setup. Yeah, we just need to get the right people to support us to do research. We did collaborate with others. If you are, you are not a student, you are in a clinical area, we encourage operational research. within the clinical setups. You just need to design small tools and collect information, even on the patient care process, and talk to the clients coming to the facilities regarding the services you are producing, and you can generate a lot of information that will enable you to discuss with other healthcare team on how to improve services within your own facility and come and present the outcome here. So we should not look at research as such a big thing requiring a lot of funding. We can use the minimal resources, even 10,000 within our facilities, just to support us to generate some information that will inform, improve our, nursing care processes. Thank you.